Well, hello, all of you in the ballroom here in DC at the Yours Truly Hotel. And also welcome to those of you joining us from Capitol Hill and also our nonprofit partners joining us via Zoom as well. And good afternoon. My name is Joy Burkhardt, and I'm the founder of Mom Congress. Mom Congress elevates the most pressing policy priorities of motherhood and brings mothers to Capitol Hill to advocate for change. This is our third annual Saving and Supporting Moms Congressional Briefing. Joining us today are members of Congress and their staff. Welcome to all of you. Also nonprofit and philanthropic partners, as well as delegates of Mom Congress who are watching us live from the Yours Truly Hotel here in Washington, DC. Welcome to all of you. For decades, the situation, and actually I'd like to advance to the next slide and thank our partners. The sponsors of the briefing are 2020 Mom, Mental Health America, 0 to 3, who we'll be hearing from shortly, and also the American College of Obstetrics and Gynecology. And the briefing is being held in partnership with the Maternity Care Caucus. For decades, the situation for mothers in the US has been difficult. Mothers needed help long before the COVID pandemic, and the needs have only grown exponentially. Since February 2020, nearly 2 million women have left the workforce to care for children during school and daycare closures. We know these labor force departures do not hit moms evenly. In January of this year, a little over 3.5% of women were unemployed. However, almost 5% of Latinas and nearly 6% of Black women were unemployed. Women with disabilities were hit with the hardest at 8%. And we'll hear from Reshma Sujani shortly that economics are intricately tied to the physical and mental health of women and their children. The CDC will be joining us as well on today's panel, and you will learn more about the latest maternal mortality data. The situation is bleak. Fast forward to 2022, February, the US began to face an infant formula shortage. By May of this year, over 40% of baby formula supplies were out of stock. Also, daycare and childcare issues are striking, and the mothers of the US need paid family leave as well. The message to Congress is clear. We need you now. We need you to not deprioritize the needs of mothers, but to prioritize the needs of mothers. Recently, Congress passed the Inflation Reduction Act, and it's an example of how Congress again failed to address long-term investments in paid leave and childcare. The bottom line is that more needs to be done to address the wide range of mental, physical, and economic challenges facing mothers and families today. Mothers need and deserve policies that support moms and families. They need what we call a mom's agenda. Tomorrow, mothers of Mom Congress are advocating to advance policies in the mom's agenda that span from pregnancy through early parenting. And this is not about parties or politics, it's about families. When moms are healthy, families are strong and thrive. And now I'm happy and pleased to introduce Representative Roybal Allard of the Bipartisan Maternity Care Caucus to welcome everyone.
Good afternoon. I'm Congresswoman Roybal Allard, and I represent California's 40th Congressional District in Los Angeles. I thank 2020 Mom and Mom Congress for organizing this virtual briefing, saving and supporting moms, and for convening this gathering of moms from across the country. I extend a special thank you to today's panelists for taking the time to share your expertise and lived experiences. Over the last 2 decades, with the help of my incredible staffer, Debbie Jessup. The status of childbirth in America and the challenges faced by our maternity care system have been a major priority of my work in Congress. 7 years ago, Congresswoman James Butler and I started the Congressional Maternity Care Caucus to shine a light on these challenges and to generate a bipartisan focus on improving positive outcomes for mothers and infants. Congresswoman Butler and I firmly believe that as legislators, we can no longer accept the status quo. We must fight to ensure safe and effective maternity care becomes a national priority for all women and babies in our communities and in our local, state, and federal government. Well, the Congresswoman and I will be leading Congress at the end of this year. The work to ensure mothers can receive the evidence-based care and support they need and deserve is far from complete. Your presence in DC this week is vital to educating our colleagues about the importance of addressing maternity care issues. I am confident your voices, your support, and your stories now and in the next Congress will continue to advance the conversations and policies so critical to achieving optimal birth outcomes for all families in the United States. Thank you again for joining Mom Congress this afternoon. We look forward to working with all of you to advance awareness and solutions to improve life for all our nation's mothers and their children.
Thank you, Representative Roybal Allard, for your remarks and your years of service on Capitol Hill. We're pleased that the members of Mom Congress will be advancing one of your bills tomorrow in their meetings with members of Congress, the Midwives for Moms Act. And I'd also like to share before we introduce our first panelist is that there's an opportunity for those of you who are joining from Capitol Hill via Zoom to drop in questions for any of our panelists today, and we'll have time for Q&A at the end of today's session. So I welcome Reshma Shujani to the stage. Reshma is the founder of the Marshall Plan for Moms, a leading activist and the founder of Girls Who Code. She has spent more than a decade building movements for women and girls here in the United States to empower them economically and to empower them to advocate for policies to support motherhood. Reshma is the author of the international bestseller, Brave Not Perfect, and her influential TED Talk, Teach Girls Bravery Not Perfection, has more than 5 million, probably many more now, views globally. In 2010, she surged onto the political scene as the first Indian American woman to run for Congress. Reshma, we're thrilled to hear from you and give you an opportunity to make remarks to Congress about what mothers need here in America.
Oh, thank you, Joy. It's such an honor to be here. And thank you so much for your leadership, Joy. It has been Moms Congress, and the work that you've been doing has just been tremendous. And I know mothers everywhere are so grateful that we have you fighting for us. So thank you. So the last 2 years have been devastating for women and families. But the pandemic only exposed the very real crisis that millions of working moms have faced for decades, trying to balance work and families with no real support, such as paid leave. I was lucky to be on paid leave at the beginning of the pandemic when I welcomed my second son, Sai. And I was grateful to Girls Who Code for providing this critical benefit at a time when the government didn't. You know, during the pandemic, we saw that women were forced to leave the workforce in droves because they couldn't access paid leave. Childcare options were already wildly inaccessible and expensive before, but they disappeared overnight during the pandemic. Industries were shut down, jobs were automated, and all of us as mothers were expected to play teacher, nurse, nanny, chefs to keep our families going as we lost our jobs at triple the rate of men. The job numbers at the beginning of the year showed that men had regained all of their labor force losses since the pandemic hit, while women were still down 1 million jobs. Although last month's jobs report showed that women's job level participation had recovered to pre-pandemic levels, researchers say that if structures aren't put into place to ensure that women stay in the workforce, it's not going to be sustainable. And this will happen again. I don't know about you, but I don't think we should just accept a return to normal that was anything like what moms were living in before the pandemic, because nothing was normal. COVID has made the case for paid leave. It promotes healthier families and children, as well as gender equality at home. Paid leave allows us to choose when and how we move in and out of the workforce without facing a professional penalty. As you know, American women don't have the access to this benefit, given the fact that the United States is the only industrialized nation that doesn't offer paid leave. This is why it's so infuriating when many anti-choice politicians take our rights away to make choices, to have options, given the recent Supreme Court decision in Dobbs. The price of everything from housing to groceries to childcare was already too expensive. With inflation at historic levels, there appears to be no relief in sight. This is why at the Marshall Plan for Moms, we've expanded the fight beyond just getting payments for moms impacted by the pandemic. Our vision is to create a world where mothers can thrive, where their children can succeed in classrooms, and that means paid leave, universal pre-K, higher wages for caregivers, and so much more. The pandemic exposed and exacerbated cracks in our long broken childcare system, one where the cost of care is often higher than women's wages, where existing daycare options are neither high quality nor convenient, where childcare deserts cover more than half the country. This spring at the Marshall Plan for Moms, we commissioned a study on childcare with McKinsey. The study found that 69% of women with children under the age of 5 would be more likely to choose an employer that offered on-site childcare benefits to help pay for childcare. 83% of them said that childcare benefits were an important factor in deciding whether to stay with their current employer or to look to switch employers. Childcare really affects women's advancement. 53% of women with young children left the workforce temporarily, took on less hours, moved to a less demanding job, citing childcare as the primary reason why they made that decision. Despite the fact that access to childcare is key to helping women return to the work, only 1 in 11 parents surveyed by us reported having access to financial subsidies. Keeping this in mind, we launched the National Business Coalition for Childcare with Archwell, Athletes United, Care.com, Fast Retailing, Gibson Dunn, Patagonia, Synchrony, and Etsy to usher in an era of supportive workplaces for employers across industries. Companies have joined this coalition with the mission to implement childcare benefits for their employees and to advocate that change industry after industry after industry, because that is the only way we will promote gender equality. Part of achieving this change really lies, though, in the way that we view motherhood. This is why at the Marshall Plan for Moms, we are committed to making cultural change. 86% of women ages 40 to 44 in the United States are mothers, and the pressures and the expectations have only increased, particularly on mothers who are in the traditional workforce. The private sector and the government need to work together to more effectively resolve these issues. You see so much finger pointing with no solutions, and moms are the ones that are getting caught in the crosshairs with no relief. In my book, Pay Up, I lay out a vision of the future of women that is the ways that we can help motherhood that is more than just an express train to the corner office. It's a world where we are not asked to fix ourselves, but we have support. Structures are changed, and that our government, our employers, our partners are all involved in changing the trajectory of our lives. This world gives us choices where we can enter and exit the workforce without penalty, where we no longer have to hide our motherhood, where we are free from bias, where our work as mothers is not denigrated or viewed as a distraction from our careers, but actually lifted up and celebrated and valued. It's past time to stop saying that policies like paid leave and the child tax credit are too expensive, that we can't do it, or that if we would, but we don't know how. We pay for what we value in this country. And I believe it's time to start valuing the work that mothers do. And that is also valuing families. We have a once in a generation opportunity to rebuild from the ground up. For decades, women have been working in a system that doesn't account for our needs. Now we are at a moment of reckoning. And it's time for our workplaces, our homes, our communities, our government to meet this urgent moment by fighting for policies we need for us and our families to not just survive, but thrive. The time is now. Thank you.
Thank you so much, Reshma, for your important work and representing the voices of U.S. mothers here in America. I am pleased now to introduce our next speaker, Shauna Cox. Shauna is the Associate Director for Science in the Division of Reproductive Health from the Centers for Disease Control. Ms. Cox is responsible for the management, monitoring, and evaluation of the Division of Reproductive Health's scientific portfolio. She has published extensively on a wide range of topics, including healthcare services during pregnancy, preconception care, and health disparities. She is passionate about equity issues and brings public health data to action to improve lives. She joined Mom Congress at this very congressional briefing in person on Capitol Hill in 2019, then to present the latest data on maternal death rates in America. Today, she's joining us again to present the latest set of data on maternal mortality and maternal death rates, both to Congress and to the mothers of America. We're so excited to get to hear this about this data, Shauna, and I turn it over to you.
Thanks, Joy, and good afternoon to all. I am honored to be here today to talk about CDC's efforts to address maternal mortality. Next slide. So before I jump into data, I want to take a moment to acknowledge that maternal mortality not only represents a tragic loss of life, but creates intergenerational impacts on families, communities, and trust in the healthcare system that is supposed to help and not hurt. We must honor the memories of lives lost by doing the work to prevent future deaths. Next slide. When we talk about pregnancy-related deaths, I do want to ground us on the definition. Pregnancy-related deaths are deaths that occur during or up to a year postpartum that are related to complications of pregnancy, a chain of events initiated by pregnancy, or aggravation of a medical condition by the physiologic effects of pregnancy. Next slide. The data I will be presenting today are the work of the Maternal Mortality Review Committees. Maternal Mortality Review Committees represent a group that come together from a variety of backgrounds, including physicians, midwives, nurses, behavioral health professionals, community members, social workers, to review deaths during and up to 1 year postpartum. They use a wide range of clinical and non-clinical records to assess whether the death is related to pregnancy, preventability, contributing factors at the patient, provider, facility, health system, and community level, as well as recommendations to prevent future deaths. Next slide. So today, CDC released 2 new reports using aggregate data from 36 states from 2017 to 2019 to characterize pregnancy-related deaths. The first report looks at pregnancy-related deaths overall, and the second brief provides an assessment of deaths to American Indian, Alaska Native persons using a classification method that is inclusive of those who is identified as more than one race or Hispanic ethnicity. I will highlight some of the key findings of these reports, and I encourage you to share these data broadly as they will be included in the chat. Next slide. So one of the major takeaways from assessment of this more recent data is regarding preventability. A preventable death is defined as a death with at least some chance of the death being averted by one or more reasonable changes to patient, community, provider, facility, and/or system factors. Among those pregnancy-related deaths with a preventability determination, over 4 in 5 deaths were determined to be preventable. Next slide. Looking at the timing of the pregnancy-related deaths, 22% of deaths occurred during pregnancy, 13% of deaths occurred on the day of delivery, and 12% of deaths occurred within a week of the end of pregnancy. Over half of pregnancy-related deaths occurred 1 week to 1 year after the end of pregnancy, a time when most individuals would have left the hospital and are in need of community support. Next slide. This slide shows the most frequent underlying causes of death, demonstrating that mental health conditions, hemorrhage, and cardiac and coronary conditions are among the top 3 leading causes. It is important to note that mental health conditions, as characterized by maternal mortality review committees, include deaths to suicide and overdose poisoning related to substance use disorder. Next slide. But when we look by race ethnicity, a different pattern emerges. I tried to color code the next few slides to visually call out how the underlying causes of death shift by population. So here we see cardiac and coronary conditions and cardiomyopathy are the leading causes of death for non-Hispanic Black persons. So we must pay attention to when we are putting strategies in place to address pregnancy-related deaths, to continually ask ourselves, are we addressing the causes that address the needs of disproportionately impacted populations? Next slide. So here we see mental health conditions were the leading cause of pregnancy-related deaths for Hispanic persons. Next slide. Among non-Hispanic Asian persons, hemorrhage and amniotic fluid embolism are the 2 leading causes. Next slide. Among non-Hispanic white persons, we see mental health conditions as defined by maternal mortality review committees are the leading underlying cause of pregnancy-related deaths. Next slide. And in the second brief released today, when we look at American Indian Alaska Native persons, we also see mental health conditions and hemorrhage as leading causes of pregnancy-related deaths. Next slide. I also want to take some time to disentangle underlying cause of death and manner of death, where there are also important opportunities for prevention. So among pregnancy-related deaths, where a maternal mortality review committee made a determination, 8% of pregnancy-related deaths were determined to be a suicide. These deaths are included in the mental health conditions underlying cause of death. Next slide. 3% of pregnancy-related deaths occurred by homicide, which are captured under the injury category as the underlying cause of death. Next slide. So these data would not be possible without the tireless work of maternal mortality review committees to abstract, review, and share these data. CDC has significantly expanded its investment to support this work, with new awards totaling $2.8 million to support additional maternal mortality review committees in 9 jurisdictions. CDC now supports maternal mortality review committees in 39 states and 1 US territory. Building this important infrastructure will help better understand pregnancy-related deaths and opportunities for prevention. Some of the work that our increased investments will focus on include incorporating the lived experience of decedents, such as new tools and resources to support key informant interviews. Next slide. Building upon this momentum, the time is now to not only continue improving the quality of data collected and reviewed, but to move that data into action. CDC also recently released the State Strategies for Preventing Pregnancy-Related Deaths, a guide for moving maternal mortality review committee data to action. This guide was developed to help facilitate implementation of data-informed strategies to prevent pregnancy-related deaths. This guide presents translating data into action as an iterative 4-step process, with each step approached through an equity lens and supported by continuous monitoring and review. And this will also be dropped into the chat. Next slide. So there are 5 strategies outlined in step 3, and I wanted to take a moment to call them out. So, for example, one strategy, eliminating racial and ethnic disparities in maternal mortality. This step includes discussion on recruiting and retaining a diverse workforce and implementing policy changes to address the inequitable distribution of social determinants of health. In the strategy, invest in and partner with communities, there is discussion of increasing funding and support for community-based organizations in communities disproportionately impacted by maternal mortality, and building and supporting community-centered approaches to care. In the strategy, ensuring access to care for all pregnant and postpartum persons, goals that work towards establishing and maintaining strong systems of care coordination and risk-appropriate care are discussed. In the strategy for ensuring quality care for all pregnant and postpartum persons, activities such as partnering with perinatal quality collaboratives can help improve and standardize clinical care and community linkages. Other efforts include educating patients, their support networks, and clinicians about urgent maternal warning signs. And we may always continue to work to strengthen maternal mortality data through quality assurance improvements and expansion of the available data sources for abstraction. Next slide. CDC also funds perinatal quality collaboratives to improve the quality of care at the population level in an equitable way. Successful initiatives include reduced serious pregnancy complications among women with severe bleeding during pregnancy or delivery, improved timely treatment for women with severe high blood pressure, and improved care for women with opioid use disorder. This is where PQCs and MMRCs can work hand in hand by implementing initiatives that address the leading causes of death. CDC will also be announcing increased support to perinatal quality collaboratives, approximately doubling the number of states we currently support. Next slide. Other efforts at CDC include the Hear Her campaign. Please visit cdc.gov/hearher if you have not already. It features compelling stories from women about their experiences during and after pregnancy, information about the urgent warning signs, resources for partners and friends of pregnant and postpartum persons to help them serve as advocates, as well as resources for healthcare providers with a focus on improving respectful care and listening to the concerns of people who are pregnant or postpartum. It includes shareable graphics, posters, and palm cards, and so much more. The pregnancy assessment, risk assessment, and monitoring system collects data from women before, during, and after pregnancy and provides data not available from other sources. PRAM's data can be used to inform programs and policies aimed at reducing healthcare problems among mothers and infants. PRAMS has been used to capture information about use of paid leave, prescription opioid use, experiences during COVID, vaccinations, and social determinants of health like experience of discrimination, food, housing, and transportation insecurity. The Locate tool is another important strategy that CDC collaborates with states and healthcare systems to provide standardized assessments of levels of care in facilities in their jurisdiction. This supports coordinated regional systems to help ensure that pregnant women and infants at high risk of complications receive care at a birth facility that is best prepared to meet their needs. For example, a pregnant woman with severe heart condition needs to be receiving care at a facility that has the full range of specialists available to help care for her complex medical condition. Next slide. So there is so much more work to be done, but wanted to leave you with this final takeaway. With more robust data, we can work to identify the drivers of disparities, implement equitable practices to address the drivers with the ultimate goal of getting to better outcomes. Next slide. Thank you so much again for the time to present this updated data to inform the efforts of initiatives in states, local communities, and across the country. Thank you. Back to you, Joy.
Thank you so much, Shauna. Really exciting to be hearing about the data for the first time today. And we encourage those on Zoom to click on the links that were dropped in chat to learn more about the detail and the data that Shauna shared. And those of you watching the briefing here in DC at the hotel, we'll be sharing this information in the app as well. So thank you so much, Shauna. Up next, I'm pleased to introduce Stephanie Schmidt, the Director of Childcare and Early Education at the Center for Law and Social Policy, also known as CLASP. Her work focuses on the intersectional needs of families and the foundational role that childcare plays in helping to meet them through federal and state policy analysis and support. Ms. Schmidt has expertise in state and federal policy and in childcare and early education, also home visiting, data analysis, and she's done some important work around maternal mental health and health equity. I'm pleased to invite Stephanie to the stage today to be talking about the latest developments in childcare and childcare policy to help inform members of Congress about where the low-hanging fruit is and also long-term policy solutions. So Stephanie, welcome to the stage.
Hi, Joy. Hi, everyone. Good afternoon. So glad to be here and to talk about this important topic today. For those of you who may not be familiar with CLASP, we are a national, nonpartisan, anti-poverty nonprofit organization, and we work to advance policy solutions at the federal, state, and local level that center racial equity to improve the lives of people with low incomes. We work across a broad range of issue areas, including education, labor and worker justice, youth and young adults, immigration and immigrant families, income and work supports, and of course, childcare and early education. If you could go to the next slide, please. So I doubt that I need to say this to this particular crowd, but childcare is really important. And as previous folks who spoke just a moment ago highlighted, it's also incredibly expensive and it's really out of reach for a lot of families. For example, in 2020, the annual cost of center-based care for infants ranged from $6,000 a year to over $24,000 a year, depending on where you lived, and a wide range of prices in between. And in most regions of the country, that care exceeds the cost of housing and is more expensive than in-state college tuition. For families and households with incomes below the federal poverty level who pay for childcare, childcare costs average 30% of their income, so nearly 1/3 of their income, which is outrageous, compared to 7% for families making over 200% of poverty. And in addition to the challenges for families that I've highlighted, there are also challenges for the childcare workforce. Childcare providers are undervalued and they're paid very, very low wages. And all of this, the great expense and unaffordability of childcare and the challenges for the workforce, are a direct result of sexism and racism, which has led to historic and systemic inequities in the childcare sector, which have been exacerbated over the history of the program by lack of investment to be able to address some of these inequities, or hopefully all of these inequities. Next slide, please. So I wanted to mention and talk for a little bit about the Child Care and Development Block Grant, or CCDBG. It is a federal state partnership intended to help families with low incomes with the high cost of childcare. And it is also the largest source of funding for childcare assistance. Childcare assistance makes quality childcare more affordable and supports parents' employment and increased earnings. As you'll see on the screen, in the most recent year that data are available, which is 2019, there were 1.4 million children reached through CCDBG with childcare assistance. This number is slightly lower than all children who are reached through childcare assistance because there are a few smaller funding streams, such as the Temporary Assistance for Needy Families or TANF program, which also supports childcare assistance. Yet, due to insufficient funding across all of these programs, childcare assistance from all of these sources combined only reaches less than 1 in 7 of children who are actually eligible for the existing programs. Furthermore, we've done some analysis that found that access to childcare subsidies is inequitable across race and ethnicity, as well as across states, very different levels of access by race and ethnicity from state to state too. This is all the result of insufficient and stagnant funding over decades that has impeded states' abilities to reach eligible children and has led to some pretty challenging trade-offs for states in who has access and also what the quality is and how well providers are able to be paid. Next slide, please. So I want to talk a little bit about COVID and the pandemic. So all of what I've shared so far was true even before the pandemic, but the pandemic certainly exacerbated the longstanding challenges of the childcare sector and really put them into a spotlight during the pandemic. The pandemic threatened the closure of many childcare programs due to the lack of resources early on in the pandemic, which really showed the true fragility of the system. The uncertainty and instability for providers of care subsequently impacted many families with unexpected closures and uncertainty about the future. And we could talk for a long time about the other childcare and early education impacts of COVID, but we don't have time for that in the short time we have together today. So I'll skip to the good part, which is thankfully Congress passed over $50 billion in absolutely necessary relief for childcare. Most notably, nearly 40 billion of that total 50 billion came through the American Rescue Plan Act, or ARPA. And these resources truly saved childcare from crumbling. The ARPA resources help to stabilize the sector, to keep childcare programs open, to support families by decreasing cost and making care more accessible and affordable. And the list there could go on forever and ever too. ARPA really made a significant difference. However, we can't address the long-term challenges of the system that I highlighted at the outset with the short-term funding that came in response to the pandemic and the crisis. The situation is going to reach a peak again as the relief resources that came through as a result of the pandemic are time limited. The stabilization grants will expire at the end of fiscal year 23, and the supplemental resources will expire at the end of FY24. Additional resources are crucial to ensure that families have equitable access to affordable, high-quality childcare, and childcare workers are adequately compensated for their essential work. Next slide, please. So without a significant infusion of dollars into the sector, the stabilization accomplished so far may not be able to be maintained. We're also so hopeful for the inclusion of childcare in the moving large reconciliation bill that passed earlier last month. Things looked really promising for childcare at the end of 2021 when the House passed nearly $400 billion investment in childcare and early education. But unfortunately, that never came to fruition, and childcare was not included in the bill that ultimately passed. So investments in childcare can make care more affordable for families with low incomes and support increased wages for care workers, raising incomes for families and for providers. Even as the economy recovers, the lack of access to affordable childcare continues to be an obstacle to employment for many families, particularly for women and families of color, making expansions in childcare assistance of critical importance. So in terms of where things stand going forward, well, we have the opportunity to build on a lot of the momentum that was created as a result of people finally understanding the challenges that the childcare sector was experiencing long before the pandemic began. In the most immediate future, there's an urgent need to be sure that childcare receives the highest possible allocation in the appropriations process, both in the fiscal year 2023 bill that's currently being considered and in the forthcoming appropriations year for FY 2024. We think this is especially critical since there was no additional investment in childcare in the reconciliation bill that I mentioned passed last month. Beyond the appropriations process, we're very hopeful that there may be some opportunities at the end of this year to secure some additional investments for childcare and early education. And in the long term, we need large-scale, sustainable, and transformative policies investments that truly meet the needs of families and providers. As I mentioned earlier, the child care relief resources run out in the end of FY 2023, which is about 1 year from now, and the end of FY 2024, which is 2 years from now. And we'd really love to work with your offices and with all the wonderful advocates and moms on this briefing and at Mom Congress to really ensure that we're supporting the childcare system so that we don't go back any further and we don't experience any challenges as a result of the end of these resources. So I look forward to questions and connecting with anyone who wants to follow up. We have many great resources at class that we'd love to share with you on spending and participation and needs. But for now, I will turn it back over to Joy. Thank you.
Thank you so much, Stephanie. I now have the opportunity to introduce Miriam Calderon. She's the Chief Policy Officer of 0 to 3 and leads the development and implementation of the 0 to 3's policy agenda, priorities, and strategies. She oversees the organization's policy center, which includes federal and state policy and advocacy tools and resources for Congress, as well as advocates like those of you in the room here in DC. She previously has served as a presidential appointee in the Biden administration in the US Department of Education, and also served as a political appointee in the Obama administration in the Domestic Policy Council and at the Department of Health and Human Services. Today, she'll be joining us to talk about paid leave for parents and other pressing policies that are critical to support mothers and ready children to be thriving adults in America. Miriam, turning it over to you.
Thank you so much, Joy. I'm so excited to be here today with my fellow panelists and really all who came to Capitol Hill to speak for moms and babies all over the country. As Joy said, I'm Miriam Calderon. I'm the Chief Policy Officer at 0 to 3, a national nonprofit dedicated to ensuring babies and toddlers have a strong start in life. And I am a mom of twins, Roman and Lucia. I was really excited to talk with you today because we at 0 to 3 appreciate really all of your leadership and partnership in working for a future where every mom and baby gets the care and support they need for a healthy birth and in early childhood. The issues that matter most for babies and toddlers are the same issues that matter most for moms, right? It makes sense. The well-being of moms and babies are inextricably linked. Today, I'm going to talk about 3 of those public policy issues that are critical for moms and babies: the child tax credit, paid family and medical leave, and maternal mental health. So first, on the child tax credit. We know poverty is a significant obstacle facing far too many moms and their babies in our country. That's why it's hard to overstate the importance of the child tax credit for moms and babies, and why it's a critical policy issue. It's a critical policy that can mitigate poverty among families with young children. And how do we know this? Because for 1 year, we got it pretty close to right. As part of the pandemic relief package, Congress significantly expanded eligibility for the child tax credit and increased the credit amount. The Census Bureau data released just last week confirmed that this policy change, among other pandemic safety net improvements, cut the child poverty rate in half last year. Let me say that again. Getting the child tax credit right puts us on a track to cut in half the number of children, moms, and families living in poverty. It's only a few $1,000s a year per family, but research shows that it can make a huge difference for moms and babies. So what are some of the things that we need to do to get the child tax credit right going forward? It starts with full refundability. If you want a child tax credit that actually reduces poverty, it has to be fully refundable. Again, Congress got this right for 2021 with a fully refundable credit. That policy change increased the average credit by about $1,000, but it increased the average credit for families with the lowest incomes by nearly $3,000, sharply skewing the child tax credit's benefits towards children and families living near the poverty line. Without full refundability, the child tax credit is much less effective as a policy tool to mitigate poverty and to promote strong early development for babies. Getting the child tax credit right also means no work requirements. Put simply, work requirements leave out babies and moms who could benefit most. Our 0 to 3 State of Babies Yearbook reports that 22% of babies and toddlers in poverty have parents who aren't working, whether for health, disability, or other reasons. We absolutely cannot leave such a large share of babies and families in poverty out of the CTC. Families for whom a little extra income would make the biggest difference in being able to pay for expenses for their babies. It's also important to underscore that the child tax credit isn't a work incentive. The EITC was designed from the outset, the Earned Income Tax Credit, to promote work, especially work in low-wage jobs. The child tax credit was designed to promote healthy child development in families, working or not, with young children. Lastly, getting the child tax credit right means making sure the credit reaches moms and babies in immigrant families. Children in immigrant families account for 1/4 of all of the children in our nation. If we don't make the child tax credit work for kids in immigrant families, we don't make the child tax credit work, period. On paid family leave, this is a top priority for babies and moms. Paid leave helps babies and parents secure relationships with their babies that are so important to their long-term learning and development. Research shows paid leave also benefits babies' health and is even a protection against infant mortality. It's also an important equity issue. Black and Latina parents and babies are less likely to have paid leave, are less likely than white families to have paid leave, and often can't afford unpaid leave. Studies show that a strong paid leave policy closes this gap for Black and Latina families with white families. So what's going to make for a really good paid family and medical leave policy going forward? First, it has to be 12 weeks at least to give parents and babies a real chance at a strong start together. It has to be truly universal, with a priority on improving access for babies and parents less likely to have paid family leave today. And it has to be both family and medical leave. Family leave promotes bonding and helps parents catch a baby's development, any challenges with a baby's development early. Medical leave is what helps families ensure that they can take time to care for all family members, including their babies, and those with significant health needs. They serve different purposes, and both of which are critical. So I want to close with just a few comments about maternal mental health. Of course, it's a mom issue. It's also a baby's issue because a mom's health plays a huge role in determining outcomes for babies. Even before COVID-19, maternal mental health problems were the #1 pregnancy complication in America. According to the American College of Obstetricians and Gynecologists, about 800,000 new moms are affected by maternal mental health conditions. Again, before the pandemic. To put that into context, there are fewer than 300,000 new breast cancer diagnoses every year. And again, that was before COVID-19. The latest statistics show that pregnant women and new moms are experiencing anxiety and depression at 3 to 4 times higher than before the pandemic. Importantly, maternal mental health is also an equity issue. Women of color are more likely to face maternal mental health problems, and they're less likely to have access to screening, prevention, and culturally responsive care. So what should we do? Our first priority as advocates is to make maternal mental health a higher priority on Capitol Hill. We have to make sure policymakers recognize it for the crisis that it is. We also need them to prioritize equity, ensuring that the solutions they advance focus first on moms with the greatest needs. And we need to start getting ahead of the problem. Care once a mom is sick is essential, but we should be investing more in community-based prevention and care systems that can keep pregnant people and moms healthy. We've had some really important wins lately. In 2021, Congress allocated $7 million for a new community-based care coordination initiative that will improve prevention efforts, and $3 million for a new nationwide maternal mental health hotline. Both of these victories are important, and they signal that the White House and Congress are paying attention. But in a country this size, these dollars and these investments are inadequate, and we must all redouble our efforts to ensure funding commitments are on par with the problem scale and reach the communities that need it the most. Thanks so much for letting me join you today and touch on these really important issues. And I am going to turn it over to Joy now.
Thank you so much, Miriam. We appreciate your remarks. I know I learned a bit about the child tax credit and the low-hanging fruit with childcare. Thank you for those remarks from class, Stephanie. We're going to open it up to questions from those joining us via Zoom. And I'll start with one that came in about paid family leave that I hope we can direct to you, Miriam. And that is, what do you believe should be the next step around paid family leave? And I'm going to add my own color here a bit. Many of you have been following the paid family leave bill here in the US know that the Family Act has been introduced, and it's been introduced for 10 years and hasn't yet moved. And Miriam, if you were to reimagine what paid family leave might look like in a new piece of legislation, what would it look like? Would it look just like the Family Act? Would it look differently? Can you talk to us a little bit about what you envision in terms of paid leave, particularly for parents? And we all know that this needs to be a bipartisan issue as well. So would you do things differently if you were to introduce a new bill on paid leave this year?
Sure, Joy. Well, I really appreciate the question and your comments. I mean, I think that, you know, I think we should really look at where we were with the Build Back Better Act legislation and, you know, some of the elements of that policy. I think there were some things right there in terms of, you know, universality, the focus on states, some provisions that were really important for equity. I think, as you note, the Family Leave Act was much more generous in certain areas. I think particularly something that I touched on was, you know, really making sure that it's a minimum of 12 weeks. So, you know, I think there are important things, as you know. We've had this legislation for a while that really is the policy that we've got right. And we've had a more recent experience, right, with some success and being able to move something comprehensive at the federal level that can really complement and build on the actions of some states that have really taken up this issue. So, you know, we unfortunately did not see that paid leave move at the federal level as part of reconciliation. And so I think we need to, what we're really talking about here is, I think we've got a lot of the elements of the policy right? We need to think about what is the vehicle and what is the opportunity to do this, and really do this with a sense of urgency from everything that we've heard from Rashma and what we know about what a difference this can make for moms, for families, and for babies.
Very good. That critical time of bonding, not only can we reduce maternal mortality rates by providing paid leave, but that critical time to bond with a child is we see trajectories and generations are impacted. Thank you for that that feedback around the policy and what it might look like. And it really is about getting it into the current framework, into the right vehicle and moving it. So Mom Congress is here to support that effort. I'd like to turn the next question over to you, Shauna, to talk a little bit about, you know, I think what we witness as mothers in rural areas or even in non-rural areas, that this disparity in terms of availability of maternity care in the US can be a challenge, and often, of course, negatively impacts those who are marginalized already in greater ways. And if you wouldn't mind, Shauna, talking a little bit about sort of if we had a master plan for addressing equitable delivery of maternity care services in the US, you know, what might that look like? Is there ability to look at a map and look at maternity care deserts and say, we will place OBGYNs and midwives and doulas in these places first where there's highest need? Share your thoughts, and also please talk a little bit about telehealth.
Sure, those are really great questions. So our sister federal agency, HRSA, does have activities where they try to place clinicians, midwives in resource limited areas to help address some of the gaps in providers for not only obstetric care, but for mental health care, as well as some new funding that is going to be working through the Healthy Start program to support doulas. We know that a lot of states are looking at how can they provide reimbursement for these community health workers that work in the communities, know the resources, and know how to connect people to care. I think the closing of facilities in obstetric and urban areas, it has been devastating for communities to really understand where there's availability to obstetric care. And so that's why activities like the Perinatal Quality Collaboratives and the Locate tool are very important. One, to make sure that facilities that are providing care to birthing persons are implementing quality improvement initiatives, and not quality improvement initiatives limited to the high-resourced facilities, but really reaching out and trying to have impact population-wide and really reaching those rural facilities, those facilities that are minority serving, and being sure no matter which facility that someone does deliver at, they're getting the highest quality level of care. Activities like the Locate tool, which I highlighted, are also very important. So states and regions, right? When we're talking about states that are frontier states like Wyoming, they have to partner sometimes with their neighboring states to really be able to understand what the regionalized systems of care are, so that we can understand, is there a need for a telehealth consult? What are the needs for transportation, reimbursement around that transportation? After immediate urgent care has been delivered, back transport to community hospitals such that people are getting the care in the communities that they know and that their support systems can reach them. So I think that there is a lot for us to learn in regards to how can we be sure that every facility has the capacity to provide that basic level of maternity care and have a plan in place to ensure that persons can get to the facility that they need to. And again, how can we really build up community-based levels of care, birthing centers, again, as I mentioned, midwives and doulas. So we're providing that culturally appropriate care in the communities by people that look like the communities.
Thank you so much, Shauna, for those remarks. I'm going to ask Stephanie now a question about childcare. Stephanie, we often hear about childcare centers and margins for childcare centers, meaning very slim margins and flexibility in budgets, even though at the same time, parents are paying an astronomical amount of funding for childcare. We heard from one mother today here in DC that in Wisconsin, childcare is $600 a week. That's the best deal you can find if you can find childcare at all. So can you talk to us a little bit about what else you would like to see happen in Congress this year and what moms can be doing to advocate for change this year?
Yeah, sure. Thanks for the question. Well, first of all, I think the reason that providers are operating on such thin margins is because they don't want to raise the cost of care for the moms and dads and parents and caregivers who are seeking care from their center or their family child care home. They don't want to make it more expensive for parents, but at the same time, they don't have resources coming from other places. And that is just a testament to why there's a need for public investment and federal investment specifically in the child care and early education system. And I think, long term, I don't think this is possible in this particular year with the remaining time that we have, but long term, we need reliable funding. We need sustainable funding that isn't reliant on the appropriations cycle each year to get the resources necessary at the scale necessary to support childcare long term. And we need childcare to be accessible. We need, more providers. So we need to support the workforce and support, women and others who are interested in entering into the workforce to be able to do that. And then we also need the physical infrastructure. We need more places for childcare to take place. We didn't talk about the childcare deserts today, but there's many places across the country where there isn't accessible care. So we need to be able to address that problem as well. And then of course, the affordability problem. We need to make it low cost or even no cost for families with the lowest income so that it is accessible and affordable for families. And then we need to address the broader workforce problem. We need to pay providers good wages. We need to give them job protections and support them in their job so that they want to stay in their job and that it's a career that's sustainable for them long term. But you asked about the short term, and I think a lot of that is going to take longer than the 4 months that we have left in this year. So I think in the short term, as I mentioned before, I think there's a really important opportunity for folks to advocate for investments in childcare and early education in the appropriations process that's moving right now for fiscal year 2023. The House version of the bill includes $1 billion for CCDBG and $1 billion for Head Start, and the Senate version of the bill includes $1 billion for CCDBG and I believe $1.4 billion for Head Start, or I may have flip-flopped those two Head Start allocations. But regardless, $1 billion or more for each of those programs. And I think it's important to advocate for that or more so that we can truly start to address, or at least not slide backwards with the progress that has been made as a result of the American Rescue Plan Act.
So helpful. Thank you so much, Stephanie. Reshma, I'm turning it over to you to take a minute to share if you could wave your magic wand, or if you could say, Congress, pass this, introduce this bill package right now and pass this. What would you want to say?
I mean, childcare and paid leave. And I know there's a recent poll that's, came out, I think today, demonstrating that the support for paid leave has increased. And what you're seeing happen in the absence of federal intervention is that there's an article last week that companies have reduced their paid leave benefits by 65%. So again, in this moment where, women are returning back to work and there's not a problem and everything is great. Not really, because it wasn't great when we were, before the pandemic, and it's not great now. And so I really believe that you cannot finish the fight for equality until you basically focus on the structural issues that are keeping mothers behind. And, that is paid leave, that is affordable childcare, that is getting rid of the motherhood penalty. I mean, the time is really now. We're not going to get this opportunity again.
Thank you, Reshma. I also just wanted to add that the mothers of Mom Congress were polled on these two very issues not too long ago. And childcare came out in the word cloud that was developed from that poll as the issue that should be solved for ASAP. Second was the issue of paid leave. And what mothers asked for was, can we please start with paid leave after the birth or adoption of a child, or the loss of a child if a baby is born still. These are critical issues for the mothers in the room here, and Congress, we're ready to work with you and roll up our sleeves along with the partners that you've heard about today. In closing, we ask you, Congress, to support what we call the Moms Agenda. It's what you heard about today. It's about the bills that we'll be advocating for on Capitol Hill tomorrow. It's not only a life or death situation. We also have to ask ourselves, do we want a stable America of the future? Do we want happy adults to serve as future workforce and leaders of America? If so, it's time to create a master policy plan for motherhood, and it's time to save and support mothers. Thank you so much.